The island's healthcare system is facing major disruptions this evening as medical consultants withdrew their services over unpaid retroactive salaries. The industrial action, which began Monday with sick-outs, has left hospitals and clinics struggling. Courtney Lewis has more.
Well, Nika, talks at the Ministry of Labour and Social Security took place earlier today, but it remains unclear how long the strike will last. Healthcare leaders, however, are warning the absence of senior consultants who are key figures in patient management and diagnosis has plunged the sector into a state of crisis. Medical consultants across the island have withdrawn their services. The industrial action began on Monday with consultants calling in sick in response to unpaid retroactive salaries. An executive member of the Association of Government Medical Consultants, Dr. Merton Smith, explains the retroactive sums were due April 2022 to November 2024 as part of the compensation review.
In requesting our payments, we're told initially that the ministry would pay us not in this financial year, but in the financial year 2025 to 2026 in a few different tranches. They'd spread it out over that year, which our members said, no, we're not having that.
A counteroffer from the Ministry of Finance for the sums to be paid within the first quarter of the next financial year, April to June, was also rejected by the medical professionals. Dr. Renee Badreau, president of the Jamaica Medical Doctors Association, stood in solidarity with consultants, saying the health sector is now in crisis mode without their seniors.
You want to think about how the Ministry of Finance and the Ministry of Health has allowed this to happen, how their actions have caused this level of instability in the health sector, how the patients are the ones that are being affected, how the patients are the ones that are experiencing the delays of their surgeries, the rescheduling, the cancelling of the clinics, how the morale of the healthcare workers have been dragged through the gullies. And if you have an unhappy and demoralized workforce, they can't serve their patients effectively.
A meeting with the Ministry of Labour and Social Security was held earlier Tuesday. The demand for the payments to be made within the current financial year is imminent, and whether or not strike action will continue is unknown.
The discussions around the table at the Ministry of Labour were not contentious. It was kind of amicable. It doesn't mean that we are seeing eye to eye, but certainly there are enough grounds in the discussion for us to take something back to our members to have a conversation.
The impact of the strike is massive, as the consultant groups are often the managers, clinical specialists and technical diagnosticians of the health sector. Dr. Smith says one of the greatest challenges is healthcare financing.
We work in the public sector with what is provided for us. Many of us would have trained elsewhere where we have acquired a tremendous amount of skills in different areas. But when we return, because of limitations in what we're provided with, we're not able to offer the Jamaican public the benefits of all the skills that we have acquired.
Courtney Lewis for CVM News.